GI and the abdomen system. So I'm just inspecting the abdomen. The abdomen is flat, it's symmetric, the umbilicus is midline and inverted, the skin is smooth, it's pink and it's even. There are no striae present and there are no lesions or visible pulsations. So now I'm going to listen to the bowel sounds, and I'm going to start in the right lower quadrant, move up to the right upper quadrant, left upper quadrant, and lower left quadrant, and there's active bowel sounds throughout. And I'm also listening to the femoral, the iliac, and the left renal artery, as well as the aorta, and I don't hear any bruits. So now I'm going to just percuss. So now I'm percussing all throughout the abdomen here, and there's tympany throughout. Next I'm going to percuss the liver span. So I'm going to go on the right side of the abdomen. I'm going to go on the mid-clavicular line. I'm going to percuss down until I hear dull, which is normally in the 5th intercostal space. And then I'm going to start in the abdomen and where I hear tympany and percuss upward until I hear like a dull sound. And then I'm going to measure in between those 2 points. And between those 2 points is the liver span. And it's normally about like 10 inches, which is what I have here. Next I'm going to percuss for the spleen, which is, we're going to start for a dull note in just behind the left mid-axillary line, and I'm going to percuss for a dull note in the 9th to the 11th intercostal space behind the left mid-axillary line. And there's going to be an area of dullness here, and it's not going to be wider than 7 centimeters. And I'm going to percuss in the lower interspace here, and I'm going to ask the patient to take a deep breath. Can you take a deep breath for me? Good. And then the tympany is going to remain throughout the entire inspiration. So now I'm going to just have you sit up. You could kind of turn around if you want to just put your legs here. I'm checking for CVA tenderness. I just need your back facing the camera here. Okay. So I'm going to look for the CVA tenderness. I'm going to kind of just, anything hurt by? No? Okay. So there's no CVA tenderness, which is what it should be. So I can have you lay back down. Now I'm going to palpate the abdomen. So light palpation's about 1 centimeter, and then deep palpation's about 5 to 8 centimeters. So I'm going to just palpate the abdomen. Anything hurt when I'm touching here? And a little bit deeper. Anything hurt? No. So there's no tenderness, and I don't feel any masses. I'm going to palpate the inguinal hernia. It's not palpable. Does anything hurt? And there's no tenderness. I'm also going to feel for the femoral pulses, which are 2+ bilateral, which is what they should be. Now I'm going to just palpate in the right upper quadrant for the liver. So I'm going to just kind of support you back here, and I'm going to just palpate here. I don't feel the liver edge. It's non-palpable, which is a normal finding. And then I'm going to just feel for the spleen. Lift up your back here. Any pain? Okay, so the spleen is non-palpable as well. And then I'm just going to palpate for the kidneys. The kidney, you kind of just use a duck motion here, and you palpate in the right flank. It's non-palpable, and then the left kidney is about 1 centimeter higher, and it's non-palpable. So now I'm going to do some special evaluations. The first one is for rebound tenderness. This is when someone's complaining of any specific pain in the abdomen. This test is done, and we test away from the pain. So we're not going where the pain is, we're moving away from it. So if the pain is over here, say, I'm going to test for rebound tenderness here. So what I'm going to do is I'm going to go away from the painful area. I'm going to hold my hands at a 90-degree angle, and I'm going to just push down slowly and lift up quickly. Do you feel any pain there? Good. So if there's no pain on release, of the pressure, then that's a negative finding. I'm also going to do another test, the ileostosis sign, which is when appendicitis is suspected. So what I'm going to have you do here is just raise your right leg, okay, and then I'm going to push down here. Do you feel any pain in your belly or anything? Okay, so if the patient feels no change, then that's negative as well. Lastly, I'm going to do the Murphy sign, and this is when I'm going to hold my hands under the liver border here. I'm going to ask you to take a deep breath, okay? And once that deep breath is over, do you feel any pain? Okay, good. So that's the Murphy sign, and that's negative as well. We're done for this section.